Good afternoon, everyone, and welcome today to our webinar. My name is Ben Russell. I'm one of the engagement managers here at Standards Australia, and I'd just like to thank you all for joining us today. This is a webinar that we're really looking forward to having, and can't wait to get started. Before we do, I'd just like to do an acknowledgement of country. Standards Australia recognises and acknowledges the Gadigal people of the Eora Nation, which is the land on which I'm coming to you from today, and we pay our respects to elders past, present, and emerging. So throughout this presentation, we're going to have a Slido code come up, and we're going to save all the questions if we can till the end. There'll be plenty of opportunity there. So a little code will pop up periodically. If you want to scan that with your phone, that'll help you get into the question section at the end. And just before we get started, I would like to just remind everyone that the information that we're providing you with today is for educational purposes only. It's not formal advice. You should seek independent professional advice before acting or relying on any of the information that we share with you today. So what we're all here to talk about is AS NZS 45003-2021 and any other standards referred to this presentation today. They'll all be available for purchase through us ourselves and also through our distribution partners, which you can see listed on the screen here. So a little bit about Standards Australia, for those of you who may not know us that well. We're an independent, not-for-profit, non-governmental standards organisation. We were founded in 1922 and we operate as an independent entity focused on developing standards that serve the Australian community. Being not-for-profit, our primary goal is to contribute to the public good rather than generating profit. This allows us to prioritise the interests of stakeholders and the broader community. As a non-governmental organisation, we operate independently of direct government control, although we do collaborate regularly and closely with multiple government agencies. We also represent Australia on the International Organisation for Standardisation, or ISO, and the International Electrotechnical Commission, or IEC. Standards Australia is the nation's representative on these bodies, and they are the world's leading developers of international standards. By participating in these international bodies, we ensure that Australian interests are considered in the development of global standards. Our involvement helps to harmonise Australian standards with international norms, facilitating global trade and ensuring that Australian products and services are competitive worldwide. We work closely with government, industry and the community to develop standards that benefit Australia. Our standards are developed through extensive consultation with a wide range of stakeholders, including government bodies, industry leaders and community representatives. This collaborative approach ensures that the standards we produce are relevant, practical, and beneficial to all sectors of society. We aim to create these standards to enhance safety, quality, and efficiency across various industries, thereby improving overall community well-being. Most importantly, our work is driven by the needs and priorities of our stakeholders. The agenda and priorities of Standards Australia are guided by the input and feedback from our stakeholders, people such as yourselves, and we actively engage with our stakeholders to understand their needs and challenges, ensuring the standards that we develop are aligned with their requirements. This stakeholder-driven approach ensures our standards remain fit for purpose and usable for the broader community. We facilitate the development of internationally harmonised standards. Standards Australia plays a crucial role in developing standards that align with international norms and practices. We work collaboratively with various stakeholders, including industry, government bodies, and our goal is to create standards that facilitate trade, enhance safety and quality, and promote innovation across different sectors. We ensure that standards provide a net benefit to Australia based on consensus from all relevant communities. The development of standards is a consensus-driven process requiring input and agreement from a diverse range of stakeholders. This collaborative approach ensures that the standards reflect the needs and priorities of all relevant parties, from industry to government to consumers. By focusing on this consensus, we aim to develop standards that offer clear benefits to the Australian community, improving safety, efficiency, and quality of life. Now, the standard we're here to talk about today is AS NZS ISO 45003-2021, and it provides guidelines for managing psychosocial risks within an OH&S management system based on ISO 45001. The standard enables organisations to prevent work-related injuries, ill health, and promote well-being at work. The standard is applicable to organisations of all sizes and sectors for the development, implementation, maintenance, and continual improvement of health and safe workplaces. A lot of acronyms, a lot of extra numbers and letters we're throwing in there. Very briefly, this is an identically adopted ISO standard. So the ISO standard and the AS/NZS standard is exactly the same. There was a great deal of Australian input into the development of the standard at ISO through our committee SF1. In particular, the chair, David Solomon, I know put in an absolute ton of hours at odd times, making sure that Australia's interests were incorporated into this one. So what's the standard actually about? It's about understanding psychosocial hazards. So psychosocial hazards are factors in the workplace that can cause psychological or social harm, affecting employees' mental health and overall well-being. Common examples include excessive workloads, lack of control over work, poor support from management or colleagues, bullying, harassment, and unclear job roles. These hazards can exist in combination and may interact with physical hazards, creating complex risk profiles that need careful management. Managing psychosocial risks to promote well-being. Effective management of psychosocial risks involves identifying, assessing, and mitigating these hazards to create a healthier work environment. This includes fostering a supportive workplace culture, providing adequate resources and support for employees, and ensuring clear communication and role definitions. Organisations should implement policies and procedures to address issues such as stress management, work-life balance, and employee engagement. Implementation within an OH&S management system. The principles of NZS ISO 45003-2021 should be integrated into the broader occupational health and safety management system. This integration ensures a holistic approach where psychosocial risks are managed alongside physical health and safety risks, following the guidelines set by ISO 45001. Regular training, continuous improvement processes, and active involvement from all levels of the organisation are key to successful implementation. So there are some steps involved for integrating this standard. Conducting through assessments to identify potential psychosocial hazards in the workplace, using tools such as employee surveys, focus groups, and risk assessments to gather data on psychosocial risk factors. Develop and implement strategies to mitigate identified risks, which may include changes in work processes, providing training and support, and enhancing workplace policies. Ensuring that the interventions are tailored to address specific hazards and are supported by management. It also relies on continuous monitoring and review. So you should be regularly monitoring the effectiveness of the implemented measures through feedback mechanisms and data analysis, and adjust strategies as necessary based on ongoing evaluation to ensure they remain effective and relevant. Establish clear procedures for the regular review and monitoring of psychosocial risks. Collect and analyse feedback from employees and data from monitoring activities to identify areas for improvement and adjust measures accordingly. Importantly, you should also ensure that the management of psychosocial risks is fully integrated into the organisation's broader OH&S management system, ideally following the 45001 requirements. This alignment promotes a comprehensive approach to workplace health and safety, addressing both physical and psychosocial hazards to enhance overall employee wellbeing. Now, before I go to our star guest speaker today, I'd just like to acknowledge the Australian Institute of Health and Safety. They've been our main partner in putting this together, and we thank them for all their hard work, and we hope that many of their members are online today. They are the National Association for the Workplace Health and Safety Profession. The Institute exists to build credibility and capability of the profession in Australia. This includes working with government, industry, allied businesses, and other stakeholders to establish best practices, research support, and innovations in the field. The Institute of Health and Safety engages with over 20,000 workplace health and safety professionals, practitioners, educators, and researchers who advise Australian and international organisations, regulators, and governments. You can learn more about them by visiting their website, aihs.org.au. Now, for our main event, our big draw card today, I'd like to introduce Chanel Neshi. Chanel is a registered psychologist with a master's in organisational psychology and human factors, and has worked in the areas of workplace mental health, employee wellbeing, safety, return to work, and injury management for almost 15 years. Chanel is currently the General Manager of Wellbeing and Safety at Bupa, and is passionate about creating healthy and safe work environments, especially within the health and care industry. Chanel enjoys the challenge of a diverse international organisation, and especially loves developing organisational and leadership capability in the area of psychosocial risk management. Chanel is particularly passionate about connecting the ways of working between human resource management, safety and wellbeing, and believes this is fundamental to improve performance, outcomes, and the success of any organisation. Chanel, welcome. Thank you. Over to you.
Thank you so much, Ben, Standards Australia and the AIHS for having me here today. And thank you everyone for being here with us today. It's really amazing to be able to share with you a little bit about Bupa and my team, and I'm always so keen to learn from each other and have had many amazing contacts and mentors along the way, which is definitely my favourite thing about this amazing safety industry. I thought I might start by providing a little bit more context into my own safety journey and why I'm here today following Ben's intro. I have, as you can tell, come into this role through a fairly non-traditional pathway. Being a psychologist by trade, I started in workers' comp and I really loved it. I started at Bupa in 2016 and was lucky enough to have a really unique position where I was able to see the ins and outs of all things WHS in this giant and complex organisation. Shortly after I started, I was given the opportunity to set up the mental health and wellbeing team, which is what we were originally called, at a time where some of that early guidance material was coming through around workplace mental health and psychological health and safety. My motivation from seeing all of these examples over the years where things went wrong, and anyone in this industry would have heard or been a part of things that we just wish we could forget. But it did really support me to choose this really rewarding and challenging and slightly different career path into safety. And it definitely has a natural alignment and interest in psychosocial risk management, which is what we're talking about today. But this brings me to Bupa as an organisation. We are a global healthcare provider with a presence in the UK, India, across Europe, Latin America, and within the APAC region in New Zealand, Hong Kong, and of course here in Australia. As an organisation, Bupa is dedicated to helping its people, its customers, and the broader community live longer, healthier, happier lives and make a better world. Within Australia, we have over 15,000 employees that serve millions of Australians through a diverse range of services designed to meet various health and wellbeing needs. Our business units include health insurance, which includes areas such as our contact centres, our retail network, claims processing, corporate partnerships and healthcare management, our aged care organisations across Australia and New Zealand. We have care homes and villages across both metro and regional areas, and health services including dental, optical, hearing, medical visa services, healthcare centres and the defence contract as well. As with many other large organisations, we also have our functional teams, of which safety and wellbeing sits within our people team. Our safety management system has been set up to follow the ISO 45001 and 45003, and the Plan, Do, Check, Act process features very dominantly. This process provides a structured approach to managing WHS risks and opportunities and allows us to continuously improve our outcomes, which was particularly relevant when we started the journey of embedding 45003 within Bupa. In the plan phase, we assess WHS risks and opportunities, including psychosocial risks, like what Ben mentioned earlier, work overload, isolated work, bullying. This really ensures that our WHS objectives are comprehensive and inclusive of psychosocial considerations. In the do phase, we implement these plans, embedding processes that address psychosocial risks into daily operations. This could involve training, policies, resources, all of which must be actively supported across all organisational levels. The check phase involves monitoring and measuring the effectiveness of these processes, and this is where data on WHS incidents, employee engagement, and certainly psychosocial risk assessment outcomes is crucial. Regular assessment helps us understand if our efforts are working. Finally, the act phase focuses on using these insights for continuous improvement. If our strategies aren't working as intended, this stage allows us to refine and enhance our approach, ensuring that our WHS performance, including psychosocial risk management, is always evolving and improving. By aligning 45003 with the Plan, Do, Check, Act cycle of 45001, we ensure that holistic and consistent approach to workplace safety within Bupa. And we have seen the efficacy of this approach most recently when achieving the ISO 45001 accreditation for one of our health services businesses, because we do have requirements with our government contracts. Here's a bit of a visual of our key risks within our business units. In health services, we see that biological hazards and infectious diseases are a major concern, as this sector is often at the front line of health risks. Ergonomic hazards, radiation exposure, and psychosocial risks are also significant here, reflecting the high stress, physically demanding environments. Emphasis on patient safety adds another layer, making this sector particularly vulnerable to both physical and psychosocial risk. Bupa villages and aged care face many similar challenges. Here, the emotional demands of working with our elderly residents can lead to significant stress and compassion fatigue for our people, particularly due to the high likelihood of exposure to aggressive or challenging resident behaviours within our memory support units, as well as the relationships that our people will sadly but inevitably grieve. Emergency preparedness is a big area of risk here, and unsurprising to most, I'm sure, manual handling is our highest cause of injury. In contrast, health insurance and business services face fewer major hazards, but they are not without their challenges. In these sectors, psychosocial risk remains a significant concern. In health insurance, the pressures of meeting customer expectations, managing high workload volumes, and ensuring compliance can create substantial stress. And most concerning for me here is exposure to customer as well as general public violence and aggression. Across all of these sectors, what you will notice is that psychosocial hazards are consistently rated as a major concern. For us, this again highlighted the importance of embedding the 45003 framework into our safety management system. So how are we enabled to do this? We have a team dedicated to psychological health and safety. This team sits alongside my other teams, safety governance, safety operations, injury management and wellbeing, and is made up of fully and provisional registered psychologists with strong and practical organisational backgrounds. Whilst we have this dedicated team, and we have deliberately made this team stand alone, to enhance organisational understanding of their role, psychosocial risk management is really ingrained in all of my amazing wellbeing and safety team members. This really supports this agenda become integrated into our safety practices overall and is pivotal to the success of 45003 framework. So with all of that context in mind, I'm going to spend the remainder of my time with you sharing a bit more detail in how we apply our psychosocial risk management framework and embed 45003 at Bupa. Beginning with an overview of the 45001 framework, which is the basis of our safety management system. As you can see, it's quite comprehensive. So for today's purposes, I'm going to highlight a few key areas where 45003 is particularly embedded. I'm going to start with leadership and commitment. Leadership and commitment are at the heart of ours and any WHS strategy, and also the 45001 framework, particularly when it comes to 45003 integration and managing psychosocial risks. To strengthen leadership awareness and capability and ensure robust oversight of these critical risks, we've implemented several targeted initiatives. Utilising the recent changes to site health and safety regulations over the previous few years, we undertook due diligence training targeted to psychosocial risk management for all of our senior leaders within Bupa Australia. This training was designed to enhance their understanding and execution of responsibilities related to managing psychosocial risks. In addition to due diligence training, we've also conducted senior leader psych health and safety masterclasses. These specialised sessions were focused on deepening our leaders' knowledge of how to practically manage key risks and implement controls. The goal was to move beyond awareness, enabling leaders to actively integrate these principles into their decision-making processes, particularly as it relates to work design. We've also provided personalised coaching on psychological health and safety for individual senior leaders, and we take a risk-based approach to that, purely because we don't have the resources to give that to every senior leader. This coaching helps strengthen their skills in recognising, addressing and mitigating psychosocial risks within their particular individual team or area. And to ensure continuous improvement and strategic intervention, we've also established critical risk working groups. These groups focus on identifying, assessing and developing strategies for critical psychosocial risks. For example, one of our very live and active working groups is dedicated to bullying and particularly sexual harassment at the moment. We've also integrated WHS agenda items into our executive leadership team and some of our business unit leadership team meetings by making not only safety, but specifically psychological health and safety a regular agenda item. We ensure that psychosocial risk management remains a priority at all levels of Bupa, driving that consistent focus and action. To support this in practice, this slide is an example of the content, some of the content covered in the Senior Leader Masterclasses, which really do begin at a foundational level in understanding the types and presentations of psychosocial hazards and risks, through to exploration and implementation of potential controls, including the principles of effective work design. Given the nature of senior leadership roles, as I'm sure you can all relate to, we really try not to burden our senior leaders with all of the regulations and the research and the literature of psychosocial risk management, but rather provide them with practical tools and insights to guide their decision-making processes. As they consider new policies, new initiatives, new markets, we want our senior leaders to always be considerate of the potential introduction of psychosocial hazards and to work proactively with us to assess risk and implement control measures. With these masterclasses, we have likewise helped our senior leaders recognise the impact of psychosocial risk management done poorly, or in some cases not at all, utilising case law and case studies, highlighting examples of individual employee distress, team dysfunction, and also the quite severe operational and reputational impacts that can happen from doing this poorly. Further support senior leaders to really put psychosocial risk management into practice, we developed our own version of the hierarchy of controls specific to psychosocial risk. If you do want to have a bit of a closer look at this and also potentially adopt it for your own workplaces, you can find a similar model utilised by the New Zealand Government Health and Safety Lead website. They excitingly developed their model with inspiration from ours, which was quite exciting for the team. So yeah, please do check that out as well. Feedback from our leaders is that they have found this visual really helpful. The second area I wanted to spotlight is our approach to employee participation and consultation. Ben mentioned earlier about this. Psychosocial risk assessment is really important, and it is something that we've been passionate about at Bupa for a number of years. We found early on in the journey that a one-size-fits-all approach was just not suitable for our workplaces, and that we needed to account for diverse workforces and work environments and create an approach in consultation with our operational stakeholders. We've also started calling these psychosocial health check, as we have found that this language is more engaging for our leaders and our people. We've tried a few different names along the way. Our risk assessment journey began in our health insurance business, where we partnered with Flourish DX to roll out the psych assessment that they have and the amazing technology that they use. This provided us with some really rich and valuable data. We were able to break down our risks into key business areas, cohorts, and make comparisons to see differences in the psychosocial risk profiles across different areas within this business unit. We then complemented this quantitative data with qualitative insight. Next, we explored risk assessment approaches within our very different aged care businesses. What we quickly learned here is that the regional and general managers' engagement in this process was necessary for success. We undertook a variety of different models over our time based on the home's preferences, and this has been inclusive of surveys, one-on-one interviews, and focus groups. All of our approaches, no matter what we do here, ensured that we measured severity, frequency, and duration of harm from key psychosocial hazards to truly meet the requirements of a psychosocial risk assessment. Following this, the data that we collect is then used to build the psychosocial risk profile of a team or a site, which subsequently informs the control development and is always done in consultation with the operational teams, the people teams, and the wider WHS team. We found significantly positive reception to this approach, and we'll soon be rolling this out across our health services business as well, and New Zealand, which is really important given the growing focus on psychosocial safety in New Zealand too. Here's some example data and insights shown in our psychosocial health check report. How much we filter the data is obviously dependent on the size of the team. For example, on this slide, with a team of approximately 200 people, providing separate risk profiles for people and non-people leaders was possible, whilst also protecting confidentiality. Through our psychosocial health check process, we also found that when we underwent interviews with our people, we were actually able to obtain additional insights specifically around protective factors, or the things that they identified as mitigating the risk of harm from the psychosocial hazards that they were telling us about. We began to include these as well into our reporting to demonstrate to the leaders of the areas the mitigating factors that are in place now within their areas and within their practices that they should continue to foster and grow. Whilst on the most part, many of these mitigating factors would not be considered controls, they are still having a really positive impact on the wellbeing of our people. The inclusion of this information not only brings a real balance to the report, but it also supports leadership understanding of what our people's needs are to mitigate risk, which we know can be really quite confronting and challenging in some of these psychosocial areas. On this slide, we can see the raw scores of each hazard broken down by severity, frequency, and duration, and heat mapped according to low, moderate, high, and extreme risk categories. It's really important to recognise, and Ben mentioned this earlier, that psychosocial hazards can often interact. And I'll give you an example of where we saw this. In one of our aged care home assessments, work overload was identified as significantly impacting the well-being of employees in this environment. However, through further exploration of this, follow-up focus interviews identified that it became clearer that it was actually interpersonal conflict between a few individuals within the environment that was actually creating disparities in workload allocation, driving staff to swap shifts, and then creating dependence on agency staff. So these effects were then driving the perception that workloads were really high and work was quite stressful. The control recommendations in this example were then aimed at addressing the conflict and the ways of working, versus on the surface of that issue, the solution appeared to be, oh, do we need to add more resources here? On the right of the slide, you'll see that we have a small sample of recommended actions. These are importantly always developed in consultation with the relevant teams and the leaders and the people within those teams. And to support in keeping our leaders accountable to make sure that this stays on the radar and stays live, we embed the risk profile and agreed actions and controls into relevant WHS plans for that particular team or site. The next area I wanted to spotlight is under check, which is monitoring, measurement, analysis, and performance evaluation. So we know that effectively using data is crucial for managing safety and psychosocial risks included within all of our organisations, including Bupa. The ability to collect, analyse and act on safety-related data is what drives informed decision-making, ensures continuous improvement and enhances overall workplace safety. Our approach to data is multifaceted, beginning with driving proactive safety initiatives. We also monitor a range of indicators that provide insights into our safety performance and the well-being of our employees. The outcome data we collect is essential for evaluating the effectiveness of our safety strategies. We closely track metrics such as accepted claims, average days to report an incident, and injury classifications. Whilst we are on the very long journey of moving away from frequency rates where we can, we do monitor lost time and lost time injury and lost time injury frequency rates and total recordable injury frequency rates. These figures, with their limitations, do help us to understand some of the impact of our safety initiatives and identify areas for further improvement. Additionally, data on hazard and near-miss reporting, mental health incidents and ergonomic assessments provide valuable insights into the broader safety landscape within Bupa. And finally, learning from our data is what really drives our continuous improvement. We are focusing on uplifting our ability to learn from the data that we collect. We know that there's a lot of instances where we feel like we're collecting data for the sake of collecting data, but really challenging why are we collecting this and what are we doing with it? And this includes conducting better WHS incident analyses, completing effective investigations, and implementing and tracking corrective actions so that we are addressing any identified issues. Here is a brief example of how we call out, specifically in our reporting, psychosocial risk, data and insights. We provide our risk committees and leadership teams regular information, both written and verbal, specific to psychosocial risk management. And this makes up a significant part of our regular safety reporting, which is really important given our risk profile and the nature of the work we do within all of our business areas. We are forever evolving our reporting. I don't think we will ever stop, but it is really important to have consistent visibility of both successes and areas needing attention in relation to the psych health and safety of our people. We also do try to bring colour and interest to these numbers and words by helping our executive leaders feel more connected to the people. And we do this through constructive and appropriate example sharing and storytelling, which we often find works probably more effectively than the numbers that we see on the page. I'll give you a sec to have a bit of a look at that. I guess the final component of our safety management system that I would really like to spotlight is our continuous improvement journey. Where we are now definitely has not happened overnight. This has been a journey that I personally have been lucky enough to be on since 2016 with Bupa, with absolutely the best team I could ask for. Bupa has made significant strides in our approach to psychosocial risk management, and our commitment to psychological health and safety is evident in terms of the progress we've made, but we do recognise that this is an ongoing journey. I think the maturity that we've achieved in understanding and managing psychosocial risks is a direct result of our commitment to continually refining and enhancing our practices. Not everything we do or have done has worked. I think the things we did 5 years ago, we might not do now. We probably wouldn't do now. And the leadership engagement we have now, we didn't have 5 years ago. So that's the beauty of evolution, and it will only get better. Now we have so much more support around us as well. So I guess everything we have done over the years has definitely helped us learn so much about our business and our people, and it's definitely enabled us to grow together as a team to overcome challenges. I think part of this journey and what makes it really possible to keep going and to keep trying is the strong wellbeing and safety people that I have around me, both inside of Bupa and outside of Bupa. I think that the respect and understanding of all the different areas within safety now and our greater purpose really helps us work together and work on this journey together. When I was invited to be here today, I really wanted to impart some helpful practical ideas and hopefully be able to answer some interesting questions. We're really proud of what we have done at Bupa, but I also acknowledge that we can all learn from each other, and there are many organisations out there doing some really amazing work in this area too. So I hope that I have achieved that today, and again, I thank you for being here with us.
Thank you so much, Chanel. That was absolutely fantastic. Look, 2 key takeaways for me. Your management training program sounds like it's quite useful. A lot of these things, as they often are, they're top down, and you can't just expect to put a policy on a wall and hope it works. You need management to get in there and get their hands dirty. So that's going great. And the model there of calling out continuous improvement, the fact that, we're talking about people here, we're not talking about sharp objects. We have to make sure that we're adapting and moving on and making sure that we're actually providing the care and the right environment for these people. So thank you so much for that. We've got a number of questions. Wow, a lot of questions have come through. So I'll start from the top, Chanel. With the reported incidents that are happening in the workplace, are you seeing any trends or there are outside factors contributing to incidents reported in the workplace?
Yeah, it's a really good question. My short answer is yes. We have seen an increase in the requests for support from a psychosocial perspective from our people, particularly in the last couple of years. There is a lot of global crisis happening at the moment, and our people have definitely been impacted by that. I think the distress in the community has also been rising. We've been watching that, and I would say that that is also reflected in what we're seeing, not only from a site claim perspective. We were tracking relatively well with our site claims compared to industry for a couple of years there. I would say that they have started to trend up a little bit now, and we are monitoring that really closely. But in addition to claims, we also track the support that people reach out to from a psychosocial perspective, and that has also definitely been tracking up over the last few years. And we do, I guess, believe that that is directly related to some of the distress in the community and what we're seeing from a social perspective as well.
Yeah, right. Now, in your particular role and the areas that you're operating in, how do you approach the integration of wellbeing and psychosocial risk management at Bupa?
It's a really good question, and I do look after both of those teams, and I love them both equally. I think that at Bupa we 100% believe taking a holistic approach to the health and wellbeing of our people is crucial. Although that largely means risk management, we do not ever dismiss the value of having a really in touch, meaningful and robust wellbeing program in place. We have seen countless times our employee wellbeing and psychosocial risk management strategies interact and complement each other, and enabling significantly better outcomes for our people. Prevention, early intervention and supporting recovery are absolutely crucial, but so is wellbeing and health promotion. I think the elements of our wellbeing program have supported our people to engage directly with the wellbeing and safety team in a way that feels really safe and positive for them. This has built trust, and it's really enhanced our ability to consult and communicate effectively with lots and lots of people within our organisation, and that has enabled better safety outcomes for us. As part of our wellbeing approach, we call out as a key pillar, and this probably ties into the question we were just talking about before, because we do get a lot of requests for support for people who are feeling incredibly distressed or in crisis, and that isn't necessarily, and in most cases is actually not related to work at all, but people come to us for support here because we very, very, very much focus on the support of our people and ensuring that we've got robust internal processes to respond and support employees in crisis. This includes a dedicated suicide prevention strategy. We also have a partnership with Our Watch, for example, as well as a lot of internal supports for family violence-related crises, for example. I think that, sorry, I'm probably rambling now. We do use our wellbeing strategy and our opportunities here to connect directly into our psychosocial risk management and wider safety strategy. But I guess my answer is that both the individual and the workplace are super important, and we at Bupa do have an equal focus on both. However, I totally 100% support that we should be fixing the work and not the worker. Those things are different. Wellbeing program is great, but not if that's what you're using it for, is to make everyone be better in an environment that isn't good. So whilst I see that workplaces absolutely do have a prime opportunity to enable people to not only feel safe, but also access tools and resources, benefits, education and support that improves their lives, both inside and outside of work, I do understand that in some organisations resources are limited, and time might be limited and budget might be limited. And in that scenario, I definitely recommend prioritising psychosocial risk management.
Yeah, thank you. And that
I
quote,
hope that answers the question.
Yeah, absolutely. Yeah. It did for me. I hope it did for the person who asked it. And you brought up that quote that I just keep hearing more and more these days: "Fix the work and not the worker." And I just think that's the best tagline for to go along with this standard. But another question that's come in, I'm particularly interested in your answer to this one. Has the focus on psychosocial risk and 45,003, has it changed the working relationship between the traditional workplace health and safety people and your HR professionals?
It's a really interesting question. And I would say that in our experience, psychosocial risk, which is really anything within our workplaces that has the potential to cause harm, in most of our experiences and the ones we support at Bupa, I would definitely say probably outside of the occupational violence, which is both a physical and psychosocial risk, but outside of occupational violence, they probably are more traditionally HR managed processes. If you're thinking about bullying, sexual harassment, performance management, investigations, workload concerns, leadership support concerns, organisational change, I think the front door to all of those types of areas where psychosocial risk is likely to present, the front door to these concerns has always been human resources. I think the world that we're in now requires and expects a deeper understanding of WHS professionals of HR and a deeper understanding of HR professionals of WHS. My personal opinion is that there's no way in which any organisation would be successful as much as they possibly could be in psychosocial risk management without this really strong understanding and the willingness of both areas to learn and share and collaborate on controls and solutions and strategies and pathways. I think we can actually achieve much more together. I think how successful I've seen that being is probably more person dependent rather than expertise dependent. And I do also think that leaders and leadership within organisations definitely have a role to play in making sure that that relationship is facilitated and as effective as it possibly could be. Because again, I do believe that that is absolutely critical to an organisation's success in managing psychosocial risk and how quickly and how well we are going to be able to do that as an industry.
Now, a bit of a practical question, this one. Do you have any examples of recommendations from some of the psychosocial risk assessments that you're doing you've actually put in place at Bupa?
Let me think of some live examples right now. So following consultation, and this was following consultation of our big health insurance psychosocial risk assessment, which we did a little while ago. And then from there, we have done more targeted assessments within particular teams. If I think of one particularly vulnerable area of our health insurance business, our call centre environments, we know that our key risks are occupational violence, low job control, vicarious trauma, and just generally trying to manage workload. You can see how those things interact as well. We've worked really closely with the operations team who are really passionate to support their people and work better in the space. There are absolutely opportunities for improvement. They've been revising escalation pathways to enable an increased sense of agency for employees to address that job control and to face into those times where they might be feeling like they're getting out of control on the call that they're on as well. Knowing that that support is there when they need it is really helpful, and that's particularly important now where we are in hybrid and remote working environments, and your leader or your teams are no longer next to you all the time. To support this even further, we have been exploring a pilot. It's an AI platform that essentially tracks the sentiment of calls and then enables leaders in real time to be alerted if an employee's customer behaviour is escalating, whether that be from a mental health crisis perspective or whether that be from an aggression perspective. That then takes the requirement out of the employee's hands to escalate that themselves, because we often know, depending on the way in which we respond to distress, some people might just not know what to do in that scenario. So we'd like to take that out of the control of the employee and help them a little bit more there where they need it. This is part of a wider approach to occupational violence within our workplaces. This reminds me of a question that we just answered a little bit earlier. Actually, it probably connects into that as well in terms of the wider environment. So we've done a review recently, and this was because of what's been going on in our environment. We've seen a significant increase in reported violence within shopping precincts this year, and an increase in unease generally reported by our people who work in these areas every day. So we did a piece of work on the physical environment of our sites, wanting to make sure that our people could tell us how quickly and easily their emergency procedures can be followed, and any concerning environmental factors or process and procedural factors that we would want visibility of. Whilst most of our sites really came back and were fairly comfortable here. Through this process, we did actually find some sites with concerns like doors that are difficult to close or soundproof glass, preventing the understanding of the emergency instructions that were happening outside of their particular area, and there were no speakers inside their area. That really, really interesting, and you can imagine being a bit problematic if you need to hear what's going on. So when speaking to our people about why they didn't report this, we have a very established property escalation process. They told us that they just never really thought about it before, which is really emphasising to me and my team the importance of that consultation, really wanting to make sure our people have the opportunity to tell us and prompt them with questions that make them think about some of these things, because unfortunately in a lot of these times you don't think about it until it's too late. So whilst this program of work is obviously managing both a physical and psychosocial, a number of physical and psychosocial risks, I think the rapid response from the team when we did start to see our people starting to feel quite uncomfortable around this, the rapid response and the thorough activity undertaken by the WHS team, by the operational leaders in this space, it's already had a huge impact on that general sense of support and comfort from our people, that we care about them and that we're onto this and that this is really important to us. And that is an ongoing piece of work, and we continue to make sure that we're establishing as many controls that we possibly can that would be helpful to them. Another example that I can think of in a different environment, and this is probably quite a simple adjustment to the way in which and that's the other good thing about this area, I think, is it doesn't have to be complex to make a difference. It doesn't have to be expensive. It doesn't have to involve too much change or too many people, particularly in large organisations where change is quite difficult to make sometimes if we're looking at systems and processes and procedures. But this really simple adjustment comes to mind for me. We were supporting a support function team and did a psychosocial health check with them. The risks identified here were a little bit different to the risks in health insurance. There were more concerns around role clarity, supportive change management, work pressure, and supervisor support. When the team dug deeper into how these risks were interacting with each other, we were able to link back to the way the communication was being cascaded throughout this team. And how communication is generally cascaded is that the leadership team tells their leaders tell their teams. And it was a verbal update these verbal updates were regularly being cascaded throughout those teams. However, these were very leader dependent. It was then resulting in potentially missed or misinterpreted messaging. And then what would happen is that the speculation and the rumours would start within the team, and that's never nice for any workplace and can often cause a lot of insecurity and distress and conflict amongst team members. This came out quite predominantly in the risk assessments that were done, and to resolve this, the team then moved to regular written updates, which were then consistently distributed across the team. They highlighted key messages, increased clarity of any team events or focus areas, any changes that were happening. And just this quite small adjustment enabled feelings of increased support and improved change management. The messages didn't change, they were just consistently applied. And the team, and we do continuously look at this, but the team have felt that this has changed the way in which they've interacted with each other and the way in which they receive this information and how it's made them feel. So linking back to the Plan, Do, Check, Act cycle, this work is consistently monitored by the Psych Health and Safety team and the WHS team as well. They work really closely together on things like this with the leaders within the relevant areas, just to determine whether these strategies are working, whether they work in the short term, whether they're still working in the long term, and then how we can essentially adjust them and improve them as that might be required.
So on the topic of leaders, to build on that, another question that's come in is, prior to performing your psychosocial risk assessments and prior to you implementing that via Flourish, did you have a lot of resistance from senior leaders? Did you have to manage that yourself? What was that process like? I understand you might not want to throw any bosses under the bus here, but what was that process like?
It's a really, really good question, because when we actually implemented Flourish, which was the first wide-scale survey that we did, It was pre the regulations being as well known as they are now, and they certainly weren't in all of the states that they are now in. So I would have thought that it was probably going to be more difficult than what it was in this particular area. I think every area is quite different, and I think driving the differences is definitely capacity and how busy they are, and another survey and survey fatigue, and I don't understand this and what's the point, etc. But I would say in that particular instance, this question is referring to with the Flourish risk assessment, it was a very easy process to roll out and quite a quick survey, so that definitely helped. And our team do a lot of the heavy lifting. So we would get the buy-in from the senior leaders, which in that particular instance wasn't too difficult. But the reason why I think it wasn't too difficult was that we basically went there and said, this is what we're doing, this is how we're doing it, this is how we're going to support you. All you need to do is please kindly ask your people to do it, because we want to make sure that we get a relevant sample size to make sure that these results are valid. So really good question there. I would say, though, to give a more balanced answer to that, it's not always that easy, and it is certainly more difficult in businesses who might have really strong focuses on, having to focus more on performance operations, or if there's other things going on within those businesses. So what we've done there is we've gone, you know what, now is not a reasonably practicable time to do this survey for you. Just to let you know, it is coming. We will need to do it. Let's plan it in, whether that's 6 months away, and in some cases it's been 12 months away. Let's just help you to plan this in, because this is a non-negotiable, and we have been lucky enough to have some quite senior executive leaders back us with that, because it is a non-negotiable, particularly for us in a business like ours. We will be doing this. You let us know when, and once we lock in that date, we are all working towards that, and then it will happen. So there is a little bit of firmness that does need to happen for areas that might not be quite ready, but we've just been a little bit more flexible, and then done an approach where we've focused on other areas that are more ready first, and just put it in the plan over time.
Yeah, right. Now we've talked a little bit now, quite a lot about top down. Let's talk about bottom up for a second. How much have worker representatives been involved in coming up with your controls of Bupa? So how are you promoting? Do you promote and encourage health and safety reps, other employees, other workers to contribute to these and have input, when particularly in areas like this where they might not feel comfortable speaking up?
Yeah, that's a really, really good question. We have a safety champion program in our aged care part of our business, which is our most geographically dispersed, as well as our, probably in terms of that, your question around the distrust. I would say that particularly we've got a lot of international workers coming in who really have grown up in different environments than what we have here. Worker rights are not as certainly not what they are here, so they don't really trust the process as much to come in and to help us and to understand and to speak up, so that we can really help them and understand what's going on for them. So I would say that it's certainly a good question, because that does happen. However, we do make sure that our safety champions are very well connected into the team in this particular area, and that our amazing safety specialists go out, they talk their language, they make them feel like they are safe with our safety people, because they're not associated with their direct operations or their direct managers. It certainly is a visibility and trust and building this over time scenario. We also do make sure that we have a number of different channels, whether that be our team, the psych team, the wellbeing team. We have a number of different channels within Bupa, but also external to Bupa, so that if we do have these conversations with them, and often in this environment that I'm talking about, to answer this, using as an example to answer this question, in this environment we do go out and do one-on-one interviews with people to make sure that they are feeling like they can trust us, and it's not a anonymous survey, which people don't really trust that any surveys are anonymous in my experience these days. But when they do see us, we explain the process to them really well, and then following that scenario, some people are really open, surprisingly, and they do trust us. I think part of the benefit of being psychologists is that we do build rapport quickly, and that's definitely been helpful. But we also make sure that they are aware of the other channels available to them to raise concerns, to raise issues. And we do have a process called Raise a Concern, which essentially bypasses leadership within the organisation and goes into the HR team. We have Speak Up, which is a completely different process again, which you can actually report anonymously. So even if we feel like our people are unsure about the individuals that they're speaking to, we make sure that they really know that there are other channels to report, which hopefully they are feeling, and they do use them. They definitely do use them, which is really good to see.
So another question that's come in, and it's dropped off my screen, but it's okay because I remember what it was. And I'm very interested in your answer to this one. In terms of how you handle reporting and giving feedback on incidences and occurrences after they've happened. So obviously when we're talking about physical things that happen in the workplace, there's a sharp object, don't touch it. The pipe has been fixed. The tap now works, right? You can put a sign up. It's very easy. If someone's reporting a psychosocial hazard, something that they've gone through, how do you, without compromising potentially privacy and all sorts of stuff like that, how are you managing that reporting feedback structure to the workers?
Really good question. I hope I answered this appropriately based on what you meant by the question. I'm going to use an example recently. I think the luxury of having such a big organisation is that anonymity is really quite easy to provide, because you talk about the scenario that's happened, and you don't even really need to talk about the site that it's happened in or anything. You can really just give people the insights as to where this incident has occurred, why it's an issue, what we're doing about it, and what we need either the leadership or the executive leadership team to know about it. And we have done that in scenarios where we've used case studies of this has happened. We've been able to maintain anonymity because we've used the case rather than anything that might link to the person in that case. I think that's a lot harder to do when you're doing it at a more local level, or when you're doing it in a smaller organisation. But for us, we definitely try to raise, for example, a safety alert in a psychosocial space by making people understand that this is something that has happened, or this is a near miss, or it's possible to happen, and just making sure that we do it in a way that that protects the anonymity of that person. And it will definitely depend on the team. So if it's in a particular team, we won't do it at a team level. We will go a few levels up so that we're sharing that information with more senior leaders across the board, so that it's really hard to track to who we're talking about, for example.
I'll just jump in for a second, Sean. I'm sorry. We've got about a minute 20 left. There's just one comment that's come in. It's not a question, just to say, wow, thank you for providing leadership in this space. It is very much needed in Australian workplaces, and provide some comfort for those who have fled or are still working in psychologically harmful places. Well done. So whoever that was is very grateful for your time.
Thank you.
With a minute to go, we'll probably wrap it up there. If anyone has any other questions, feel free to contact us and we can pass them on and get an answer. But I'd like to just thank again our partners, the Australian Institute of Health and Safety, for helping us put this together today, and all the members that have showed up, and all the other people that have showed up today that aren't members of that organisation. Thank you again to Chanel for your time, your thought leadership in this space. It's been fantastic. We really appreciate it. And thank you to everyone who showed up and took time and interest in this topic. And we hope that this standard and the information that Chanel's provided will go a long way towards helping improve a lot of workplaces around the country.
So much again for being here, and hopefully it was helpful.
Thank you so much, Chanel. Good afternoon, everyone. Again, thank you so much for coming, and I'll see you next time.